We were excited. We, wanted to have another baby. We knew that. We weren't planning on it quite so soon, but we were planning on having another baby, and so we were very excited at the prospect, and for William to have a sibling close in age to him. We laughed through the ultrasound, and already seeing him really active and moving was fun because we didn't even realize we were as far along as we were. So when we were in the appointment for the 20-week ultrasound and the tech had left to go grab the doctor saying that he needed to talk to us, my husband pulled out his phone and started Googling right away, and then the doctor walked in and said, sorry to tell you, but your baby has what's called a congenital diaphragmatic hernia. And right away I started crying harder and my husband started crying. I mean, we were terrified. It was life or death, literally. We didn't know what condition he was in, how severe the defect was, if he was going to make it.
1 out of every 33 babies has a birth defect. Time is precious, but often there's a breakdown in care for babies and mothers. Until now.
Pregnancy is a joyous occasion, so when a woman finds out that she was pregnant, the journey begins with our OB, our obstetricians, or OB specialists. During a routine visit, a mom finds out if her baby has a birth defect, then the OB physician now needs to refer her to a high-risk pregnancy specialist, may not necessarily working in the same facility. And if that birth defect requires additional specialists to help care for both the baby and the mother, then the baby has to find another facility.
The Johns Hopkins All Children's Maternal, Fetal and Neonatal Institute is transforming care for mothers and babies, helping to provide the best outcomes possible.
We at Johns Hopkins All Children's Hospital making life easy for those moms and the parents. So we have OB physicians, high-risk pregnancy doctors, and subspecialists to help provide seamless care. As an academic institution, we bring in state-of-the-art treatment approaches, incorporating research where necessary to offer state-of-the-art care.
This is why we're investing in a fetal care program that will unite our high-risk physicians and neonatologists with our pediatric subspecialists across the organization that can help determine a care plan for these babies even before birth. Our unique approach to care spans from conception to early childhood, with a focus on specific patient cohorts called niches. The approach follows groups of patients including neonatal abstinence syndrome babies exposed to opiates in the womb, babies with intestinal issues, heart problems, oxygen problems, extreme low birth weight, and mothers affected by toxic stress.
We have assembled all the conditions that we see in the neonatal ICU under the niche cohort is because I see a common denominator of these conditions and some changes that occur in the gut or the bowel compartment. Changes in blood flow, changes in bacteria with associated changes in biomarkers which are linked to long-term neurodevelopmental risk.
Care here does not end at the time of discharge for mother and baby. Johns Hopkins All Children's is establishing a follow-up care program designed to track care of developmental, behavioral, and other health outcomes for children through their preschool years.
So there are two major advantages of the follow-up program. From a patient and a family perspective, they continue to receive the care in the same healthcare setting by the same specialists so that the relationship is established and the care is seamless through childhood. From a physician and clinician standpoint, we'll be able to collect the data and allow us to understand it to provide better care for our patients in the future.
Right from the start, one of the things we really liked about Johns Hopkins All Children from the beginning was that team feel. That we felt like they were communicating, that our surgeon was working with maternal fetal medicine and they were working with, to the ultrasound techs of what they were looking for. And so that same continuity of care is what we got once he was born.
Help us provide hope for our families. We need your investment to provide our mothers and babies with the best care and new discoveries. Be a part of creating healthier futures for our tiniest patients.